Hello, my name is Ilana Breen, and Dr. Wu and I are delighted to present our abstract, The Nickel Pickle, a systematic review examining the efficacy of a low-nickel diet for nickel allergic contact dermatitis and systemic contact dermatitis. A little bit about me: I graduated from Mayo Clinic School of Medicine, and I am currently a first-year dermatology resident at the University of California, Davis. I am interested in wilderness dermatology, laser and minimally invasive therapeutics, and skin cancer in aviators. For fun, I enjoy spending time with family, watching animals in the wild, playing the piano, and flying. Can you spot the animals in the background image? And welcome now to the feature presentation. Nickel is the leading cause of allergic contact dermatitis worldwide. In fact, approximately 10% of the Western European and North American population is affected by nickel sensitivity. Nickel allergic contact dermatitis, a T-cell mediated delayed type hypersensitivity reaction, is characterized by an eczematous pruritic eruption that may include papulation, vesiculation, oozing, weeping, and edema, which may progress to a lichenified chronic form, including fissuring and scaling. Photos are displayed in the image gallery here. While history taking is integral, epicutaneous patch testing remains the gold standard for diagnosing ACD. In severe cases, the burden of disease can be disabling. As the most common contact allergen that is also ingestible, cutaneous nickel allergy is not only precipitated by contact exposure, but can also be caused by systemic exposure via dietary consumption. This entity is termed systemic contact dermatitis when limited to the skin, or systemic nickel allergy syndrome when there are both cutaneous and extracutaneous manifestations. Given this relationship, dietary modification has attracted attention as a potential treatment. In this study, we conduct a review of experimental studies examining the therapeutic impact of nickel dietary restriction on nickel allergic contact dermatitis and/or systemic contact dermatitis. Our systematic review yielded 11 studies of nickel allergy treated with a low nickel diet, Prisma diagram shown in the methods section. The most common diet prescribed was an avoidance diet, which comprised a list of nickel-rich forbidden foods, such as the avoidance diet displayed here on the top right panel. Other diets included a point system diet, a compiled list of foods organized in a point system with a daily point maximum, and the Brahmani diet, a nutritionally balanced curated diet listing acceptable foods and recipes. The average duration of the low nickel diet intervention was 42 days, ranging from 4 weeks to 2 months. Heterogeneity in primary endpoints limited a pooled analysis of the 1,271 individual patients. But qualitatively, all 11 studies reported improvement in dermatitis for some or a majority of patients. Qualitatively, the range of complete remission rates in the various studies was from 24% to 82% of patients, and the range for marked improvement was between 39% to 80%. In one study, long-term improvement was reported in 70% of patients following 3 years of a low nickel diet. Patients with systemic nickel allergy syndrome showed improvement both in cutaneous and gastrointestinal symptoms as high as 98.1% in one study. Literature supports therapeutic benefit of low nickel diet, particularly in allergic patients resistant to conventional therapies, such as emollient creams, topical steroids, calcineurin inhibitors, immunosuppressants. However, its utility and practicality are limited by adherence and the ubiquitous presence of nickel in everyday foodstuffs and drinking water. Given the prevalence of nickel allergic contact dermatitis and systemic contact dermatitis, and the high morbidity of persistent severe forms, therapeutic dietary nickel restriction should be explored by providers with appropriate patients in a shared decision-making model given the nuances and challenges of implementing a low nickel diet. My contact information displayed here below. Thank you so much for listening and have a wonderful day.